welcome once again to another edition of our Government at Work program, a program brought to you by the CCM-led Nevis Island Administration and hosted by yours truly, Keith Scarborough. It's a program designed to inform and educate all citizens and residents of Nevis, both at home and abroad, of the many positive developments that are taking place here on the island of Nevis. It's another wonderful Thursday evening here in Nevis, and it's a time when we all look forward to a night filled with information as it pertains to the continued good governance of the CCM-led Nevis Island Administration. We look forward each week to go deep into discussions with the ministers of government, the advisors, the permanent secretaries, the department heads, as well as top officials from the various statutory corporations here on the island of Nevis. As always, we make every effort on this program to keep all of our discussions as frank and as honest as possible in order to give our listeners and viewers a true reflection of the developments that are happening here in the land that we all call home. This program, I remind you, is broadcast live on VON Radio every Thursday evening from 8 to 9:30 p.m. Then we broadcast on Nevis Television on Sunday evening from 8:30 p.m. This and other Government at Work programs, as well as our Bird's Eye View programs, can also be seen on our Facebook page, YouTube, and the NTV web page. On a footnote, I wish to advise those of you who have Flow TV that we are currently experiencing some technical difficulties with our programming at this time, which has nothing to do with us, of course. The problems with the Flow internet lines, which I am told is being worked on as we speak. So once again, we apologize for Flow TV viewers and hope that the situation gets rectified as soon as is possible. Just a reminder to our Flow viewers that the NTV can be found on channel 103, and those of you who have digital TV, NTV can be found on channel 99. So make sure that you're logged on every day of the week for our news package, our informative programs, and of course our entertainment package. We shall take a short break, and when we return, I shall introduce my guest for this evening program to you. So stay logged on to the powerhouse of the Eastern Caribbean, VON Radio 860 AM.
Is right, St. James's, put together and build your land. Right, St. George's and St. Paul's, together with St. John's. This land is enough for all to share. No reason to leave and go nowhere. Foreigners can come here from America and England. There is something mighty sweet about my land. And if the foreigners who live here can insist that it's here they're from, then I swear I'll never leave my native land. One people, one country.
Welcome back. Folks, I am pleased to have as my guest this evening the Honorable Jahnel Nisbett, Minister with responsibility for health, social empowerment, gender affairs, etc. Honorable, welcome to our Government at Work program once again.
Thank you. Always a pleasure to be here with you.
It's a pleasure having you as well. I hope you had a wonderful Easter and that you got in some much needed rest and relaxation.
I mean, our Easter here in Nevis is filled with so many fun-filled family gatherings, public activities, so I enjoyed quite a bit. The kite flying at the flats, the Department of Gender Affairs had a kite making workshop, so they also were flying their kites. I think I had a grand time, but not necessarily a restful time, but it was time well spent.
I realize you didn't rest listening to you. Well, we have quite a bit to discuss this evening, so let us get into our discussion. And I want to start this evening discussion looking at our healthcare service. During the last budget presentation, the Premier and Minister of Finance, the Honorable Mark A.G. Brantley, allocated some $12 million towards the completion of the diagnostic wing at the Alexandra Hospital. It is expected that work will reconvene on that wing sometime during 2025. Could you give us any further update as to where we are with regards to the startup of works on that project?
Currently, we have received back a project proposal in terms of completion of the project with financial information, timeline, etc. That is being reviewed by our Planning and Public Works Department, and they'll be able to give the feedback to Cabinet on that. But I can say that we are definitely working towards restarting this project this year. It is a priority area.
Okay. Good. You have any actual completion date in mind? You think maybe by the end of 2026?
I really don't like to speculate as much. I work very much on facts. So once I'm able to get back those hard numbers from the department and the contractors, then I'd be able to share those.
Okay, great. Now, some have sought to make a big issue of the fact that there has been some delays along the way. But I have said to many persons that the health services in Nevis is in the best shape that it ever was. But you are in a better position than me to speak to that. So walk us through some of the services that are being offered at the Alexander Hospital as we speak.
I mean, we can use up the whole show discussing the services at the hospital. But I mean, you have in terms of diagnostics, you have your CT scanning, mammogram scans, x-rays, ultrasounds, emergency room services, outpatient services, colonoscopies, physiotherapy, our lab who provides testing on a cross-section of areas. It's a full-fledged hospital with generally most of the services that you can hope to access.
Right, and those are all being offered currently?
Currently, yes.
Very important that we make that point. Now, periodically, we hear of new pieces of equipment that has been donated to the Alexander Hospital and others that were purchased by the CCM-led Nevis Island Administration through the Ministry of Health. So enlighten our listeners and viewers of the type of equipment we now have at the Alexander Hospital. Just give them an idea as to.
Okay, again, in terms of one of the biggest piece of machinery that we have is the CT scan machine that we have. That was a much needed area that gap needed filling, and I'm happy to say that was filled, that's being utilized by the individuals on Nevis. So you don't have cases where they have to be transported to St. Kitts in order to get that critical service where 24 hours, 10 minutes can be the difference between life and death. So you have that. You have our mammography services, one of the most top-of-the-line mammogram machines that we have available to our public. We have new machines to blood analyzers in our lab. We recently added, in terms of our flamboyant nursing home, we added a new hydraulic shower trolley to be able to better care for the residents who are immobile, and you need to be able to shower them and care for them properly. New beds that are able to be more automated for changing, for removal from the bed. We're continually updating and adding equipment where necessary. So yeah, you just have to call and ask if you're wondering about a service, but we're generally updating on a regular basis.
Okay, great. Now, there was a time when we had very few nurses and doctors at the Alexander Hospital. Those of us who are old enough can relate to that. But today it's a totally different scenario. Outline for our listeners and viewers the current status as it relates to the amount of nurses and doctors that are currently on staff at the Alexander Hospital. Give them an idea.
Once upon a time, you could answer that at the drop of a hat when it was one doctor and three nurses. Right. The answer to that is dynamic. So in terms of doctors at the hospital, the last count was around 20. But that number in itself does not reflect all the doctors who provide services at the hospital, because we have those who are employed to the Nevis Island Administration, but we also have many specialist doctors who are visiting. You have individuals like Dr. Thwaites and Dr. Jeffrey Libert, who, by the way, just performed a groundbreaking surgery.
I read it today.
Yeah, groundbreaking surgery there in Jamaica. So we have that quality who are often coming once a year, twice a year to provide services at the hospital. So in terms of hospital, if we want to go with a base number of who's in-house on a daily basis, we have 20 there. And that does not include the 3 who service our health centers, because we also have doctors who are present on different days at the various health centers so that individuals can access that service free of cost. Nursing is a similar case where always I signed an employment letter to add a nurse today, so that number is also continuously growing, and it differs as well from the hospital to the public health arena. So in terms of at the hospital, the last count that we were able to have was around 30. Again, that's dynamic, so it shifts slightly up and down on a regular basis. That includes our matron, nurse managers, registered nurse, emergency medical technicians, nursing assistance. It's just very dynamic. And then if we go into public health, at our health centers, that's another maybe 15, 20 nurses there again, and assistants there again. So it's really a dynamic number, and the nurse to patient ratio is definitely high. A good number. It's a good balance right now, even though we continue to try to add more.
Okay. Now, there was a time when nursing in Nevis was seen as one of the better jobs on the island, and as a result, all of our nurses were Nevisians. Today, we are struggling to get our own Nevisian ladies to take up that career in nursing. Any idea what's causing that reluctance?
I think the first step, Israel will correct you right there. You said Nevisian ladies. We need both our Nevisian men and women to take up nursing as a career.
Those days was just
traditionally, yes. So we are encouraging both men and women. So some of the things we've actively been doing is attending the school fairs, showcasing what's involved in nursing, etc. We've been providing financial support to individuals who are opting to study nursing at CFBC. So we're providing that support structure, and we're getting the numbers in. I think some individuals are also maybe a little shy of the 4-year bachelor's program as well. I don't think it was that once upon a time. But this program is there to upskill and make sure our nurses are qualified and can operate anywhere in the world. So we continue to encourage males and females to get into the nursing profession.
Is there any local male nurse?
Yeah.
I know you have male nurse at the hospital, but local guys.
I don't think we have any local. I'm not sure if he's local, but I feel like you're so embedded into the community now. You're just considered Nevisian because you're part of the Nevisian family. So, but we definitely want to encourage them to get into that. While we're on the topic of nurses, the nurses will be celebrating their Nurses Week from the May 6th to the 12th, and that's another way that they use that week to promote the career and encourage individuals to get in. So I can just share some of their standout activities that they'll be having. They'll be visiting some of the sick and shut-in former nurses, and they'll be doing that on the 6th of May. They'll be having a cultural day. That one is very good at the Alexandra Hospital lawn on May 7th. That day they usually have different foods, the Guyanese food, the Jamaican food, the everything. By the time I went around 12:30 last year, I almost didn't get, because it was very popular and the food was so good. They're having some symposiums, social activities such as a hike, to encourage fitness. And they have their T-shirt day on May 12th, where individuals are encouraged to buy the T-shirt. This helps the Nursing Association to raise funds as well and be able to, participate in those. And I can't forget their all-inclusive boat ride. So definitely participate in that to help them raise funds. That's $120, and that will be on Saturday, the 10th of May.
Saturday, the 10th of May. Okay, great. Now, I want to take you back to the diagnostic wing for a little bit, because when that wing is completed and become fully operational, a number of specialized service will be offered there. I mean, it's already offered, but in that particular wing. But for that to happen, specialized training in those areas will be needed. Speak to us a little about your training program in preparation for what is to come in the not too distant future.
In terms of the expansion wing, most of the services that exist currently are what will be restructured and moved into that space. So we are already offering most of the services. In terms of additionally, when we're able to shift the space and gain space at the current wing, where we'll be including specialties such as dialysis, and we also are planning towards having a mental health ward, in a sense, where you can house mentally ill patients as well. So training, upskilling is a constant practice at the Alexandra Hospital. There are several programs that they do in-house, where when visiting specialists come, the Lamat mission was here, for example, and they did some training in resuscitation of infants, those type of training. So currently, the permanent secretary is reaching out to our counterparts on St. Kitts and externally to discuss what needs to be in place for the dialysis unit, because as we know, it's not a plug-and-play type unit. And once we're able to get that feedback and information, we'll be able to know how to coordinate training in certain areas and what specialty skills we might need. In terms of the mental health ward, where we've been rolling out several programs to be able to train individuals at our behavioral health unit and anyone in general who's interested in mental and behavioral health and wellness. So I think it's a continuous training program, and as needs arise, we are definitely filling those gaps.
Great. Now, I deliberately went through that exercise of getting you to give us that update on the services that is being offered, of course, and the update on the diagnostic wing itself, the amount of nurses that is there and the amount of doctors that is there, because there are those who are giving the impression because the new wing is not yet completed, that somehow the health services in Nevis is not up to par. And the truth is, the health care in Nevis is the best that it has ever been. I've said that earlier, and I'll keep saying it because I knew what it used to be in the years gone by. So your thoughts on that observation? Or
my thoughts on that are really that we always want better as a people, and we always deserve better. It's not something that should be frowned on. I think where we have to balance that is understanding that while we can always want better, that does not mean what we have is bad. What we have is quite good. Exactly. But it's okay for us to aspire to be better, and so that's what we're doing in terms of the expansion, becoming better, building on the good service that we currently have. So I just want to encourage people to think that way, because that is actually what we have. As you're building your new home, as they would say, your current apartment or your current house is still very much providing shelter, warmth, and serving the purpose that it needs to.
Right. Now, I want to turn your attention now to the daily operations at the hospital, starting with the visiting hours, of course, because many persons seem to be confused as to when is visiting time, who are allowed to visit, and on which days. So could you shed some light on that for our listeners and viewers?
In terms of visiting at the hospital, you're allowed to visit every day except Tuesdays and Thursdays, and there are two set of visiting times, 11:30 to 12:30, and then you have 4:30 to 6 p.m. So every day except Tuesdays and Thursdays, and that is because those days are generally surgery theater days, and you need all hands on deck. You don't need individuals coming in that can compromise the nature of what's going on.
What about close family? Because I would have heard the complaint that the close family members went to visit but were not allowed to visit. They went outside, of course, the visiting time.
Again, you have to have structure in place.
Yes.
For an organization like that, you must have structure in place.
Sure.
A lot of individuals are on shared wards, so you also can't have individuals just coming and going all day, as individuals need a certain amount of rest, etc.
Right.
So in certain exceptional cases, you can go, you can make a plea, etc. But even as close family, you still have to respect the structure of the institution. But it's dynamic, so I think you have reasonable individuals, and if it's an emergency situation or a one-off situation, they might be able to facilitate. You might need to drop something and they can deliver it to your family members. So it's not so much that you can just come when you want because you're a close relative.
Good point.
For minors, that's something different that as well can be adjusted for a pediatric patient, for example, versus adult patients.
Great. Now, the fees honorable for healthcare services in Nevis is very cheap in comparison to that of other countries in the Caribbean. Barbados, Jamaica, Trinidad readily comes to mind. Yet some citizens and residents alike here in Nevis complain every time they have to pay for the services rendered. Some even refuse to pay. When this diagnostic wing is up and running, how do you propose to deal with such situations? Because you and I know that if they had to go to the US or the United Kingdom or any of the Caribbean countries that I just outlined, they will pay without uttering a word. How do you get them to understand?
I think it's general open conversation we have to keep having, because left to us, sometimes everything would be free, but everything comes at a cost. So someone somewhere has to pay for it, and the government is all of us. So if you don't pay for it in one respect, you'll pay for it in another respect. And we don't, individuals may be upset if you add income tax or something of that nature. So these are mechanisms put in place to be able to keep the system running. So the healthcare on Nevis is heavily subsidized.
Yes.
Heavily subsidized. You're contributing a mere fraction towards the actual cost of the provision of healthcare. So I just have to encourage individuals to realize that it's a community effort. You have to make that contribution. One night stay at the hospital is less than a mixed drink in most restaurants on the island.
That's
and
true.
for that one night stay, you get your 3 meals, you get care, you get medication, you get nurses, attendants, etc. So we have to be able to place a value on our health and understand that that's worth our money, because we spend our money on unhealthy things. So it should not come as a struggle to spend your money on your health. Of course, we understand that there are vulnerable groups in our community, and so we have safety nets in place to be able to assist those. So the mentally ill, disadvantaged seniors, those individuals are able to access certain services free of cost. General individuals who are low income, you can make applications to the ministry for serious surgeries or serious medical issues for up to 10,000 EC per year, and you just have to fill out the form and provide the required information. So we do have safety nets in place for those who need, but those who just want, and as we might say, bad mind,
Those are the ones I'm
you
talking
have to
about.
you have to be encouraged to pay, and we have been encouraging them to pay. We've ramped up our collections and made sure that individuals are at the desk at most hours to be able to collect payment upfront, etc.
Okay. You use the word encourage quite a bit. Don't you think the time will come when you have to introduce enforcement measures?
I mean, there are some enforcement measures in place, but we will never refuse emergency health care to an individual. So I think we need to move from a system where everything has to be forced. We need to appreciate collective responsibility.
Sure.
Your contribution to paying for your medical consultation may very well be that money that goes towards saving the life of your child, your mother, someone else who needs health care. Because if you can't pay doctors, you can't pay for the medication, then how are we going to provide that service when someone for you needs it? So we have to realize it's a collective responsibility. And I don't like the slave master approach of having to go with a whip. I think we're all adults and we can appreciate that social responsibility.
I think they appreciate it, but they just... Anyway. Now, the Ministry of Health, under your leadership, has been offering some free assistance to members of the public from time to time in several areas of healthcare. Mammograms, breast cancer screening, sugar tests, pressure checks, to name a few. But I'm sure there are other areas where assistance is given from time to time. So enlighten us further if you can.
Okay, so let's start with the medical assistant program that I just mentioned. So
Right.
that's in place through the ministry.
Right.
So in serious medical cases, you apply with the necessary paperwork and you can receive up to $10,000, not handed to you to go and do anything, but generally paid towards the medical institution. In terms of, when we introduced the mammogram machine, we had a promotion where we wanted to be able to ensure that at least during one period, every woman on Nevis in the Federation could access this service without barriers. So it was around a 7-month period where we offered free mammogram services to individuals without requirement, and I'm happy to say 499, just 500 basically, women would have capitalized on that free mammogram services. So that's something that we do to be able to provide accessibility to healthcare. Since then, there've been a nominal fee attached to it, but this year, in honor of Women's Month as well, we sought to be able to encourage women, do something for women, and give free access to mammogram services again for a week period. So women were able to access this service for free at the hospital. I think this time during that week period, 66 women were able to capitalize on it. When I spoke to my staff at the hospital, it was like the time slots were filled to the point that they had to roll over some to the next week. But those are some services. We also expanded our antenatal program, and that is in our health centers basically. So we've started offering some initial free tests to women who are pregnant. So we offer like your first ultrasound free, certain lab work that you have to do at the lab free, dental check because that also affects maternity free while you're pregnant as well. And this is not across the board again. Generally most people can access it, but if you have something like insurance, we would ask that you at least fill your insurance so that the program is sustainable. Yeah. But for individuals who are uninsured, that program is available. That's one of the free areas. So we do continuous checks in different aspects of society, in churches, in towns, where you just check your pressure, your blood sugar, your BMI to know your numbers, because the health promotion unit has been focused on individuals who think they're healthy, you feel healthy, but you don't really know what's happening in your body.
True.
And so that has been made free and accessible. HIV tests are always accessible and free at our HPU unit. So it's a lot that we're doing to be able to ensure that everyone has free access, affordable access.
And I deliberately asked that question because I want persons to understand again that a lot is being done for them free of cost, because as you and I know, in other countries around the world, those cost plenty money.
Yeah.
And in a matter of fact, in some countries, that service is very hard to come by. Let me ask you this. Why do you think people take these things for granted here in Nevis? Do you think it's a matter of
I think it's
education?
A lot of time it's exposure as well. So you would have a lot of individuals who visit here, and if they're part-time resident here or they had to use a hospital while they were visiting, generally they tell you, oh my goodness, I got through so quickly. Like if you have individuals from the UK and Canada, for example, I've talked to some individuals who say how long they might have to wait to be able to see a doctor, even though they have like their insurance scheme. Yes. They have to wait for months sometimes to get an appointment. Yes. So I think it's a conversations that more people need to have to understand what's out there. Because individuals who go to the United States to have children, for example, they come back with a $30,000 US bill. And if you see that externally, and so you're able to appreciate more what you have. I think it's individual nature to think that what you have is not enough. It's nature. So it's not unique to us.
All right, I hear you. Now, I want to focus your attention now on a couple of things that has been affecting us over the past few months here in Nevis. The first one being the hand, foot and mouth disease that has been affecting our children. Could you give us an update on the current situation? Is it still affecting the children? If so, how is the Ministry of Health fighting it, etc.?
The last update I received was around last Monday, and the total number of reported cases for hand, foot and mouth was 128. And at that time, I'm happy to report that the Chief of Staff at the hospital reported that there were no new cases. So that was the previous number, and that there were no new added cases. So it seems to be under control at the moment. And I think some of the things that we put in place were we had PSAs through our HPU. We encouraged the schools to re-implement, if they hadn't already, like washing hands and sanitization in their classrooms, etc. We had certain cases at certain schools where once you saw a certain number of cases, you might close that classroom for a certain period of time. So I think those measures all together really started working, because right now we're seeing the numbers declining, thankfully.
Any idea what caused that?
And that's just a general disease that's spread among children, and it's very easy among children because children will be children. They will touch things, they will put things everywhere. It's generally not life-threatening for the average child. They go through it and they get over it. So it's nothing unique per se.
Okay, great. Now the other area of concern is the flu-like symptoms that has been affecting quite a few persons here in Nevis since the start of the year. Any idea what's driving that particular flu?
Anecdotally, I'd say, seasonal. You have the flu annually based on the numbers.
Different. You have flu every year.
Every year we give them a special name and we say they are the worst ever. But based on the numbers, we also get updates on those. Based on what made it to the hospital in terms of influenza type symptoms, we had 34 for the year thus far, and I think 8 in the last reporting period. So the number is not at such a level that it's alarming, at least not what is reaching our hospital. But I can't say from my non-expert opinion that there is any serious outbreak, because right now there is not from a medical point of view.
Okay, all right. Now I want to take a look now at the health centers around the island, starting with the big one in Charlestown that has been closed to undergo some repairs. Could you give us an update as to where we are at this point and when you expect that center to come back on stream?
Well, first, center, Charlestown Health Center, is fully operational in its new location. Yes, so at its new current location, it's fully operational. The dental unit is there. All the services are there. We've expanded services there. The space layout is more conducive to be able to take in clients. We have areas where they can do pap smears, etc. So it's actually quite a conducive environment to be able to seek medical attention. In terms of the facility, the plans are to work towards a new Charlestown Health Center. So right now they're in the design and feedback stage of that initiative. So you have to design, meet with all key stakeholders, make sure what will go where in necessary areas. Then you will have to do the required assessments to see if this feasibility of this structure in this spacing, etc. So right now we're at the planning stage still for that, but we have ensured that the Charlestown Health Center at its location is full up and running.
Okay, just for those who are listening, the Charlestown Health Center is currently in the Girls Guide building.
No, not the Girl Guide building, the building where Development Bank was previously.
Oh, by Wards?
Yes, by Wards building.
Oh, that's where he's at. But he used to be in the Girls Guide building, no?
No.
No, he was always at Wards?
He was always at Wards since it moved.
Oh, okay. Thanks for the information.
See, that means you're healthy. That means
I have never been there.
Oh, that means you might need to go for a checkup.
All right. Thanks for the information. Now, the one in town that is due for some upgrades. So what you're saying is that there's absolutely no work going on there.
No, there's no work going on there right now.
Okay, that's what I wanted to know. Now, speak to us about the other health centers around the island. Give us a little update as to the operation.
Those centers are there. They're offering the usual services to the community. As I say, we have a schedule where we have 3 doctors on the district, and they rotate from health center to health center. So there are various days when they might be at a different health center. So you have those services. You have pap smear services that are offered at those centers. General dressing, wound, they manage the diabetics. They offer antenatal support, vaccinations. So all the general supportive services that you can find in community health, they have been providing those for the different communities.
Okay, now the ministry has been making an appeal for persons to visit the health centers around the island for minor treatments such as pressure and sugar checks, minor aches and pains, dressings, etc. that you just mentioned a while ago. To sort of ease the pressure off the Alexandra Hospital, what has been the response thus far?
I think the response is relatively well. Individuals are opting to take up some of the services, especially I would have shared the flyer regarding the doctor days as well fairly recently, and an individual would have reached out and said they weren't aware that you offer some doctor services, consultation services at these health centers. So that's something we're sensitizing the public of what's on offer, and I think some individuals are definitely taking that up rather than having to go at the Alexandra Hospital, because at the health centers care is also free.
Sure.
Free of cost. There's no cost to see the doctor. There's no cost at the health center in general for general services.
Maybe you should mention that more often, because I don't think they know that.
But that's one of the things that we promoted when we were doing the free mammograms, because you have to have a doctor's referral to access it. So some individuals complain that was a financial barrier, because you have to pay $100 or so for your doctor. And then we did remind them that we have doctors at our health centers on different days, and we were able to share that information. And so some individuals would have opted for that route to get that free service as well.
Okay, that's good. Now, I understand that the dispatches unit that was put in place some months ago is now up and running. Are you?
The emergency dispatch system?
Yes.
Right now it's it's still in its testing phase. Right now we've had the dispatchers trained, we have the radios installed, we have the antennas installed, but I think we're experiencing some difficulties, not on our end necessarily, but there is some technical programming and wiring that's still being worked on to get the calls to transfer from one line to another seamlessly, because we don't want to go live, for example, and there's a case where you can't transfer a call from our police station to St. Kitts or to the Alexandra Hospital. So they are working out those kinks. There have been some tests that they've run in simulations, and so we're hopeful that that would be fully up and running very soon, but it is at a point where we can definitely be proud of what we've done thus far.
Great. Now, when it becomes fully operational, everything is in place and it's going, what would be their responsibility? What's the role of those dispatchers actually?
The role of those dispatchers, they are the first point of contact. So first thing, their role have to be to keep whoever's calling calm. Your role is to be able to keep them calm, gather all the required information from them, and be able to dispatch the necessary personnel. So an incident might be a car crash, that there's also a fire or somebody needs to be cut out the vehicle, so you have to dispatch the police, the fire, and the EMT services. And in certain cases they are also trained in first aid, etc., so they should be able to guide an individual, for example, who's calling with a choking. Even while they've dispatched, they should be able to guide you and say, this is what you need to do to be able to provide emergency care to that individual. So that's their role.
So the person that is in distress no longer call the hospital?
No. You call, if you call the emergency number, if it's 911 or different identified number, you call that number and it gets you to that dispatch center. And that dispatch center is able to send who you need to you. So you don't have to, you're in distress, you don't need to be calling the police, the hospital, finding the landline, getting transferred to, if you're calling 911 currently based on where you're on the island, you might pick up Antigua, Anguilla, somewhere else. So we are trying to be able to triangulate and better capture our emergencies so that we can respond quicker.
Okay, great. Now, in terms of the ambulances, there has been some concerns raised, and quite rightly, that some persons are suggesting that the ambulance should be based in different parts of the country, rather than all at so when you call from Gingerland, the ambulance is close by. If you call from Newcastle, an ambulance is close by. What's your thought on that suggestion?
Mean, that thought is good in theory. In reality, if you look at like bigger countries, this area, the entire Nevis would be where one district, maybe even half a district that one hospital has to respond to. So ideally they're based at the hospital, because when a certain call comes in, there's no go bag for everything. It's a different tools, different medication, different treatment that may be required for that specific case, and they have to grab and go. So you can't stock the ambulance with everything. If you're now based in St. James and a call comes in and you don't have those supplies, now then what do? You come to the hospital, get them, then go back. So we're at a point where Nevis is small, and generally while the ambulance, they've tested their times and they've been able to make it to most scenes, and by 10 minutes is their aim to get there in 10 minutes or less. I suppose if it's further, it might take slightly more time. But they've been able to maintain a good arrival record, and they're continuously working on it. Another purpose of the dispatchers would be also to help to gather information on the exact location of the individuals as well, to help emergency personnel get there without getting lost, etc. So with the resources, we always have to work with the resources we have. So the resources we have, the hospital is fairly central, and so that is a good base point to be able to get to most individuals on the island.
Okay, great. You brought up a point there that caused me to think something. In the bigger countries, well, we are small, but the bigger countries, you have specialized doctors. You go to the doctor and it's your knee and you're sent to this one. Your elbow, you're sent to that one. You think?
I think we're we're moving towards that here as well, but it's something that we should, while we want specialized care, we also have to recognize that our population cannot sustain certain specialized care for that, just that small thing. A doctor might end up with one patient every 2 years if it's a niche area, and then because they want to practice and upscale continuously, then they might leave. So we do have to continuously appreciate our general medical doctors, but we also encourage individuals to specialize in certain areas, especially those that are fairly common that we need to continuously supply.
Sure. Now, before I leave the health sector, which I will do in a while, I want to ask you about dialysis, because we seem to be having quite a few patients of late who are developing that kind of illness, if I could use that word, Well, it's a possibility of us having that facility. I know we are waiting for the diagnostic wing to be completed. Would that be part of that diagnostic wing when it's open?
So based on the planning and layout, the plan would be so that when certain services are moved to the new wing, once it's open, that frees up an area that has been earmarked right attached to the new wing. That area has been earmarked as the ideal area for the dialysis unit to function in. So what we're working towards is for them to be on the same timeline, in the same general timeline.
So whenever that wing is open, hopefully we'll be in a position.
Yes. So we're already starting to explore what is needed to have that functioning, because there's water purification systems, specialized cleaning, so that one requires thinking ahead, and we've already started thinking ahead.
So that was going to be my next question. But in terms of training specialized nurses for that, I know some efforts were being made some time back to get nurses prepared and stuff for that. Where with regards to that are we?
So right now, as I say, we're recollecting the data, because this is the plan going forward. So we're collecting all the data that we need. We're seeing what works and what doesn't work, especially for our counterparts on Syncets, because they offer the service. So if we're able to understand the challenges, etc., that they have, how it operates, then we can see how that we can also be able to duplicate that.
Okay, but there's every intention to have that in Nevis at some point.
Yes, but while we're on that, though, I don't want it to. We're also having a dual approach to the problem that we're having so much individuals going into renal failure, because the solution, the solution cannot be to just treat to keep you alive. Basically, the aim is to be able to reduce the number of individuals that make it to renal failure. So our health promotion unit, again, has been doing lots of sensitization. We're planning for programs, more comprehensive programs, to identify the pre-diabetics and the pre-individuals, the individuals that are on the borderline of these diseases, lifestyle diseases, to be able to reel you back, in a sense. Alcohol is one of the things that's driving renal failure as well. So we are sensitizing, educating, and because our solution has to be prevention, because dialysis saves lives and maintains life, but it's not a cure, and most individuals don't want to have to make it to that stage.
True. Folks, you're listening to Government at Work. My guest this evening is the Honorable Jahnel Nisbett. We shall take a short break, and when we return, we shall continue with our discussions here on Government at Work.
Is right, St. James's, put together and build your land. Right, St. George's and St. Paul's, together with St. John's. This land is enough for all to share. No reason to leave and go nowhere. Foreigners can come here from America and England. There is something mighty sweet about my land. And if the foreigners who live here can insist that it's here they're from, then I swear I'll never leave my native land. One people, one country.
Welcome back. Honorable, there are quite a few other portfolios that falls under your responsibility, including, of course, social empowerment, gender affairs, community development, and the solid waste management unit.
Yes.
I want to focus a bit on some of those portfolios, especially social empowerment, because that ministry has been doing so much and for so many persons across Nevis that it will take us all night to speak to all of it. That ministry has undertook several workshops in almost every area that one could think of. So I want to give you the opportunity now to speak to our listeners and viewers about some of the work that ministry has conducted and perhaps those that you have upcoming.
Okay, so we do quite a bit of workshops. A lot of the workshops are aimed at upskilling our people, being able to encourage individuals to maybe gain skill to create micro businesses, etc. So between the Department of Gender Affairs and the Department of Community Development, I think those two departments have the most of those developmental workshops. From Gender Affairs, some of them that I can think of, we had our TDC car care clinic for women.
Yes.
So women were able to learn about basic car maintenance, etc. through partnership with TDC. We had a women's tiling workshop as well through partnership with TDC. And after learning how to do the tiling, we put that into practical action, and we actually went to JLPS and we tiled an entire classroom, so the students were able to benefit from a classroom with new tiling free of cost from that workshop. They have the backyard gardening workshop. I saw some videos of the produce just today, and those are coming along so nicely. So I know we have a lot more backyard farmers as we move towards food security. We have the fish pot making workshop that we have annually. That one is coming up soon. I can't remember the dates off the top of my head, but one question that individuals often ask, how do I know? How do I know? I would suggest you follow the Department of Gender Affairs. They have a Facebook page. Follow the Department of Community Development. They have a Facebook page that they share this. So in terms of community development now, they've had sewing workshops. They've had food processing workshop. One of their upcoming workshop is, I think that started already in April actually. It's a floral arrangement workshop. We had our boys and girls of class during the Easter vacation, and an exciting one that I'm looking forward to. This one is just a 2-day one, is an auto body repair workshop that they'll be having. So you'll learn some of the actual work that goes into like auto body and spray painting a vehicle and stuff like that. So that's on May 16th and 17th. So follow the pages because we are always having activities. I was speaking to one of our project coordinators at Gender Affairs today, and she was listing the electricity's coming up, there's a plumbing one coming up, and so she was just telling me about the pipeline. So definitely follow the page to be able to be in the know, because generally as soon as you put out some of these flyers, the classes are snapped up because people really appreciate those.
Okay, great. And I know you participate in the
I participate where I can. I do love to engage where I can.
Yes, yes. Now the Ministry of Gender Affairs is another ministry that has been doing quite a bit, especially for our youths and our elderly here in Nevis. Again, I want to give you the opportunity to address some of those good things that your ministry has been doing for the people of Nevis on behalf of the CCM-led Nevis Island Administration.
Okay. So in terms of our seniors, that's spearheaded by our seniors division in our social services department.
Right.
And our seniors program it's so vibrant. Our seniors are engaged in Valentine's luncheon. They had elocution contest last year, spelling bee. There was a fashion show. There was a throwback party. There was a senior sports day. We had moonlight walks and karaoke nights for the seniors. So they are active, engaged, and definitely the program is thriving right now. We celebrate all the milestone birthdays, the 80, 85, 90, definitely our centenarians annually. So it's really good realizing how much we value our seniors. And funny enough, we have just, Nevis Charlestown has just been identified by the PAHO WHO as the first age-friendly city in the Eastern Caribbean. So we are the first in the entire Eastern Caribbean to receive that designation from PAHO and the WHO as an age-friendly city.
That's great news.
Exactly, and that's because of these programs. It's a testament to these programs and showcasing how much we integrate our seniors into everyday life.
That's very good, very good. Let me ask you about the pan, because they used to play a lot of pan, but I haven't been seeing it lately.
They're not playing pan as much. I think it's such a dynamic group. They often want to try different things, do different things, and they have the opportunity to do that. So if this year they want to have a sports day instead of a pageant, and next year they want to have a disco, we allow them that space and opportunity and facilitate where possible.
A few years ago, we had the Senior Screen Show, which was a big hit.
Yeah.
But I haven't seen it.
Again, it's dynamic. So every year, they have their seniors meeting in different communities. You have central, etc., and they discuss activities that they want to have. So it's not so much us planning activities and giving it to them, like, do this. It's an engaging conversation. So it's what they want as well. So if they decide that a Queen Show is something they want to advocate for, then a Queen Show is what we'd work towards trying to put on.
Okay, great. Now, the seniors are the beneficiaries of a lot of things that the government is offering to persons of that age group. Remind our listeners and viewers of some of the things that that is being offered to our senior citizens in terms of benefits.
As I said, that's our recreational program, for example, is one of the biggest benefits, I think, of being a senior. I think senior care is more expensive in some countries than even daycare. So those services and programs that we are providing are absolutely invaluable. In certain instances, there are certain programs that we have in place that we are working on revamping currently. So this year we are rolling out a comprehensive program to showcase some of the benefits that can apply to seniors. What we are moving away from is a blanket net approach where everything is for everybody, because that is not sustainable. So everyone can access the community activities, the social activities, etc. But there are certain individuals in, higher socioeconomic status, etc., who might not need, for example, a free water bill, but others in the middle, lower income can benefit from that. So those are some of the things that we are working on compiling a strategy towards making sure that it's sustainable for the long run.
Okay, I hear you. When I was talking about benefits, I was talking about the lights that is being offered to a certain age group free of cost, or the water that we offer free of cost.
Yes, and so there's some currently on the program, but the program has not been adding any automatically. So I don't want to promote it as an automatic program, because it's no longer automatic. As we work to revamp it, we are putting systems in place where we can categorize the seniors based on their income level, their housing structure, their family support, and be able to tailor programs to you, tailor benefits to you based on your need, not just a blanket approach.
Okay, I'm happy that you made that point, because there was a time when it was said that if you're 65 and older and living on your own and so forth, you get so that is no longer the case.
It's not an automatic situation anymore.
I'm happy that you brought that to the fore, because I know
when you make 65, you might not need free lights,
I hear you. I was just trying to get that sorted out. That's good. Okay, the Community Development Unit is celebrating a whole month of activities.
Indeed.
That too is under you. How many things are under you?
A lot.
Starting May 1st right down to May 31st. Tell us a little about the planned activities that you intend to have in celebration of that month, including the theme under which these activities will be held.
Okay, let's start with the theme. So they decided this year that they wanted to engage the community a bit more. So to come up with the theme, we had a competition. And the winner of that competition was Kejel Smithing. And the theme for this year is Together We Grow, Together We Thrive, Our Community, Our Pride. And that's the umbrella theme under which we'll be operating this year. So, and as we speak about Together We Grow and Thrive, one of the main activities that they do is a community care food drive. So right now it's been open from April 15th to May 23rd. You can go to the department and drop off food items, toiletries, etc. that will be put into care packages for individuals in different communities who will need those. We start every month celebration generally with a church service, get that blessing. And so for this month, we'll be celebrating at the Beulah Seventh-day Adventist Church on May 3rd. And then we go into my home village, Jessup Seafood Fiesta. That is always one to remember. I am a seafood lover myself, so the Jessup Seafood Fiesta normally has the fish, the lobster, the food, so much good food based around seafood. It's activities, there's dominoes, there's family fun, etc. So that is on May 5th. I think this is the 11th year, so bigger and better. On May 8th, tune into the podcast that will be surrounding Caribbean migrants' masculinities. So we're collaborating with the Department of Gender Affairs there. And May 17th to the 18th, that's the beginners auto body repair workshop that I say I will be definitely dropping in on to see what we're doing there. On May 22nd and 23rd, there's the annual jumbo sale at the department where, individuals can come and get pre-loved items. We know we're thrifting now, we're recycling everything, so we're promoting that lifestyle. On May 27th, we will be distributing the food care packages that were collected. And April 22nd to May 29th is the floral arrangement workshop that I mentioned earlier. And to round off this month of activities, we're having the second annual Nevis Multicultural Heritage Festival. And this festival will be on the 31st of May at the Malcolm Gishard Recreational Park. And that runs from 12 p.m. to 7 p.m. And at this festival, you can find different nationalities. Last year, you might have Ghanaian, you have Guyanese, you have the Trinidadians, you have not just Caribbean but global groups represented, and they're showcasing their foods and their culture. You can buy samples of different foods. So if you haven't had some doubles in a long time and you see a Trinidad stand, you can grab some doubles and experience different culture. There'll be activities for the kids like bouncing castles, etc., entertainment, cultural acts. It's really going to be everything that you need in one place: food, fun, family, music, festivities. And so definitely everybody needs to come out to that multicultural heritage festival.
And this starts when?
12 p.m. to 7 p.m.
12 p.m. to 7 p.m. Okay. That sounds very interesting.
Yes.
Is that
this will be an annual? Yes, last year we had the first one, and this year we're making it even, building on that to make it bigger and better. And so the hope is that it builds into something uniquely Nevis that embraces all the nationalities that come here. The Nevis Nice song say, people we never thought we would live to see people migrate to my country. So we're appreciating everyone who've migrated here, settled, and is contributing uniquely to making it a multicultural society.
So the hope is that become a calendar
activity annually. Yes.
Oh, I hear you. But I was asking, is this month of activities an annual thing, or this is the first time?
No, this is it's an annual thing, but we're getting more structured and more unique activities where we're making it more dynamic. So every year it's a building process, and so I'm happy to say that I definitely endorse the activities for this month.
Sounds good. I like the last one that the Nevis Multicultural Heritage Festival.
Yes.
Sounds very interesting. I'll be there to see what it's like.
Wonderful.
Let me ask you this. The Social Empowerment Ministry from time to time assists persons in need of a home. If they get burnt out or there's no place for them to live. Have you done anything like that lately?
I think once upon a time there may have been certain programs prior to my time. But again, I keep speaking about sustainability, because one of the key definitions of that is being able to meet the needs of this generation while protecting our ability to meet the needs of the next generation. So we have to always remember that. And so it is impossible to build houses for everyone in need, everyone in want. It is simply not economically feasible. And so what we've introduced is a program currently where for vulnerable individuals, if you need assistance with labor, our maintenance team will come out and assist with building on a bathroom if you're able to provide the materials. You know, your community effort, you might get a small loan, the family pool together, and we're able to provide some skill set to support building that. So we were able to do that for a gentleman in Gingerland. The community came together and provided materials, and we created a whole new room structure, wall structure with wheelchair accessibility, painted it, etc., so that is now moving ready for him. There are extreme circumstances where you had a resident in Bath who lost his home in a fire, and that was an extreme case where it was a vulnerable individual, a senior. It was unforeseen circumstances. Your home was actually gone, and in that case, we really had to step in to be able to provide back a structure for him to be able to reside and have that independence. So we do make provisions for certain things, but I think there have been individuals who've been asking for a 2-bedroom wall house. And if we could, we would definitely provide that, but it's simply unsustainable to give one individual a house that costs somewhere around $350,000. How do you justify that to the Nevisian public to say, well, this person got this much, but you cannot get that as well?
I asked the question because somebody who knew that you were coming on the program this evening wanted me to ask that question. So I'm happy that you were able to.
That's the answer to that.
Right. I'm happy that you were able. Because I know they're listening. So I know they're listening. This solid waste unit, Honorable, is very important in any and every country. It is one that we rely on to take care of our garbage, our waste, and to have our surroundings kept clean and healthy and friendly.
Oh, while you're mentioning solid waste, I'm cutting you off for a minute. I just want to be able to recognize Mr. Andrew Hendrickson.
That's where I was going.
Okay, wonderful. Because he would have recently retired, and he put in years of service, and that is someone who, he did not simply go to work. He was passionate about the job that he was doing there, and so you could feel that passion every time he communicated about a project or pushed the recycling project. So I really have to extend the appreciation of the ministry, of the Nevis Island Administration and Cabinet in general for his service in that area, as he has now opted to go into his own private enterprise, Orange Enterprises, which I kudos to him as well for expanding his entrepreneurial reach. But definitely I have to register my thanks to him on that note.
Well, I'm glad you did that, because that is what I was going to ask you a while ago. Now, Mr. Hendrickson, since we're on him, there was a program the solid waste units was looking to restart the vehicle cleanup campaign in 2025. Are you in a position to shed any further light on that for us?
Last year we collaborated between the Ministry of Health, Solid Waste, Environmental Health in general. We collaborated with the NHCS, who would have received some funding, and they were able to clean up a lot of vehicle wrecks on the island. One of the difficulties we're having is individuals who are insisting on hoarding these vehicles. We offered that service last year through that funding with NHCS to be able to clean up those for free, so individuals could have capitalized on that. It's not necessarily something that can be done it's not government's responsibility to collect these vehicles, but as a cleanup campaign, and through that funding, we're able to work together, but some individuals were still resistant. So there are mechanisms in place where they can legally be given like a citation of sorts, and then that would require them to move the vehicle, and if government has to do the moving, then they can be billed for the cost of those. And I think sometimes as a people, we have to really recognize how we're affecting the island and our neighbors. It is not good to have your property and there are 10 abandoned vehicles at the side of the road, etc. So I'm encouraging individuals to clean up their own wrecks, take them to solid waste. Right now, we're working on plans to try and get a lot of the scrap metal out of Nevis. Those are still in discussions to be able to see if we can get in a company to be able to come and remove some of those scraps. But on the vehicle aspect, individuals really need to play their part. When funding becomes available for these cleanups, etc., definitely don't fight the department, don't fight health, don't fight community initiatives. Get on board and ensure that Nevis is clean.
That's true, I hear you. But I was more talking about the same scrap metal that you just brought up a while ago, because remember that had started,
yes,
and then it had stopped, the company went off, and but my understanding was that they were thinking of
we are in discussions trying to navigate that. It does require a lot in terms of getting a barge here. The company is getting a barge here to be able to do that. So can't confirm that they'll be able to do that in the near future, but it is something that we are still actively trying to facilitate.
Okay, great. The solid waste unit was also looking at having a recycling plant installed
Yes.
at the site in Long Point. Is that still on the cards?
Well, they definitely have the recycling program up, running, active. They've definitely focused first more heavily on the plastic bottles, and the last statistic I was able to get, they mentioned that they thought they were capturing about 40% of the plastic bottles that were being discarded on the island. We've, since the start of the program, we've shipped last year one 40-foot container, and this year another 40-foot container out of Nevis to be recycled. I'm happy that I was able to go to St. Kitts in the last month to witness their first shipment out as well. So as a federation, we are moving towards recycling. Right now we're in an additional phase of the program through collaboration with Taiwan ICDF, where we're bringing an even more powerful crushing machine so that that one can compact the material even further, so it's denser and it's more profitable to ship. In those cases, you can crush cans easier because we are moving towards aluminum and cardboard as well. So we have started constructing an expanded facility, so that's well on the way, almost near completion. We're waiting for the equipment and some supporting machinery to be able to kick off the expansion of that. But the program is up and running, and I'm so proud of the work him and the staff on Nevis were able to put in to create that culture that I think we're building on.
Okay, great. Now, Honorable, you have quite, like I said earlier, quite a lot of portfolios under you and are doing quite a lot. What new initiative you have for 2025? Because I know every year a minister or persons will have new initiatives. But you have so many ministries. I don't know. What are you looking at to be doing in 2025 in terms of new initiatives for anyone in ministries, actually?
I think one of the key areas, we talked about the seniors program before, that's one of the key areas. It's been in the cards since last year, and we've been pulling, because we've had a situation where benefits are so disjointed. Sometimes you might go to the hospital and you're senior, so you can get this medication discounted or free, etc. So we've been pulling all the information across government, from social services, health, etc., to compile a package, an umbrella care package, senior program, which will include evaluation, categorization, and your benefit package that you can access as a senior on Nevis. So that's one of the major programs to roll out this year. We're hoping that the technical difficulties of the emergency dispatch system, that those kinks could be worked out in that area, and we are also awaiting our transformer to be able to make the expanded kitchen that we would have done at the hospital. The works are there, the machinery is in, and so we want that to go live at the moment. In terms of, I think sometimes we always look for the big flashy projects, but we're always working on smaller things. So we're like, one of my passion areas, I'm trying to encourage more activities in the flamboyant nursing home as well. I know we care for our residents, so one of my personal pushes to engage them more in different activities on a regular basis rather than just, one-off, to keep them socially engaged in that way. So I think those are some of my areas, and the big things will come. The hospital expansion is a major area that we are focused on, but we've been focused on a lot of these smaller programs, making sure that they are thriving. Speaking of which, our RISE program through social services, that's our family program where we provide cash assistance, but it's conditional in that you have to do some subjects, upgrade, open a bank account, little things. They're getting training to be able to upskill. That program is celebrating 10 years this year.
Speak to us a little about that program.
That RISE program is an excellent.
Do you have an age group? Or?
It's family. So that program targets a family unit. So it's not an individual can't get the program by itself. So it has to be a family unit. It's either 2 or 3 or more individuals. So you can contact the social services for that department. But it's no specific age group, but a family. And the individuals have to express a willingness to change their situation, because it's not just an automatic cash.
These are family in need, actually?
It's family in need, families who want to improve certain situations in their life. So if you're in the family, you identify needs of the different family members, and we help to work towards improving those. So children in the family might need extra reading classes that we help pay for. The adult might need some classes so that they can sit a CXC, so that we've had a number who have done CXC subjects. You might need help with job training. We help to attach you to those. We encourage and mandate that you do certain things. So if you have children, you have to ensure they get the required checkups at the health center. You have to do basic things, open a bank account. It just helps to create a structure to break the cycle of generational poverty in that sense. So it's not a handout program. It's not just a poverty alleviation program, for example. It's for individuals who are economically disadvantaged. It may have not been any fault of your own. You could be born into this, but it's an avenue to be able to reshape your entire family structure and the generations coming after you.
Honorable, tell us a little about your awareness program, because I am hearing about a lot of things here that I never heard before. So
yes.
Enlighten us a little about your various awareness programs where people could get this information, because I'm telling you the truth, there's some things that you're mentioning here that I'm hearing for the first time.
So that is one of my priority areas as well, to make sure that individuals have access to information. So we are working towards that. I did have a meeting with the RISE team, that same program, I think yesterday. Yesterday, and we were discussing how you approach, putting this information out there as well, especially through social services. Traditionally, a lot of the programs have been very shielded and sheltered, because we have this stigma against poverty. I'm not certain what bred it, but we have this stigma. And so we are working to actively break this stigma. To be part of this program is not poverty thing. It's about trying to empower your life. So we've discussed strategies to be able to have advocates, etc., to promote. In terms of Ministry of Health, they put out their information on quarterly magazine, under the scope. We've been our social media is very full with information. So in terms of health, you can get information at Health Promotion Unit Facebook page. If you want community information, you can get it from Community Development Facebook page. If you want gender affairs information, you can get it from the Gender Affairs Facebook page, because that's one of the areas that I ensured when I came in. I ensured that the Department of Community Development developed and activated their page so that people could know. and we have our communications unit that puts out information that's happening within the ministry as well. So we're really, information is there, so we're really trying to ensure that it gets to individuals in the public.
Okay. I know you have quite a lot on social media, but you deal a lot with our senior citizens who doesn't go on social media. So
I mean, you might be surprised.
Yes, some try, but
yes.
Do you have radio programs and stuff like that where the senior citizens could get easier access, because some of them might be going on social media, but I'm sure quite a lot of them.
We don't have radio programs as such, as I say, for the seniors. Seniors are old school. We like to meet. They meet on a regular basis, so the different community groups meet scheduled time at the different community centers, weekly, etc., based on their schedule, and then they come together for major events. So it's not so much as to get them via that medium, but it's always good to come on shows like this to be able to get the information out.
I always offer you
in a different medium
platform to get your message out. Your communications unit,
yes,
does that?
Yes, they've been working to put out a lot of information as well. So they've even developed some programs of their own. So that unit would have started a program recently, small business focus, identifying young individuals in the community who have a business, a small business, and they highlight what the business does, showcase the individual, and increase traffic towards their businesses. They've highlighted individuals who've gone abroad to study and their experiences to encourage younger individuals to access those scholarships opportunities as well. And they are generally there to capture the events that we have. They work with NTV as well to share a lot of the captures in terms of the senior birthday editions, and they keep the social media very active in terms of showcasing. Sometimes I can't keep up with all the different things across the ministry, and I go through the page to make sure I'm not missing anything, and sometimes they have an activity there, and so I'm able to keep up sometimes there as well.
Okay, I know, but you have quite a lot on your hands. Honorable, I want to give you the opportunity once again to speak a little about your recap on your Nurses Week that is coming up, and of course when that is finished, speak on your Community Development Month activities, because I want you to be able to get the information out to the general public as to those two functions, because especially the community development activities, because the first time I am hearing them, and I'm sure several of our listeners are hearing them for the first time as well.
Yes.
So I want to give you the opportunity to.
So before I jump into these ones, I do have to also give recognition to our lab techs, because we are celebrating Lab Week currently. We're well into Lab Week, and so they've been having a number of activities. But since we are Thursday night, tomorrow is their final day, and one of the things, they're wearing blue tomorrow, and they generally have an activity if you go to the lab and you're able to identify an equipment or specimen or something that they have, a trivia, and then you get your lab test free for that day. So that's
just
something.
Hearing it for the first time. This was
so
amazing.
if you're going to the lab tomorrow, go participate in the activity. You never know, you could get your lab test free. You can ask questions about the services they have at the lab. And we're blue because that's their color for tomorrow. But definitely have to give a shout out to them for their activities as well. For the nurses, their week go from May 6th to 12th. And the nurses do quite a lot of fundraisers and social activities during their week as well to put into their different programs. So, but they do social work as well. So on Monday 5th, I will give general remarks as customary as Minister of Health. Tuesday 6th, they'll be visiting the sick and shut-in nurses. On Wednesday 7th, they have their cultural day at the Alexandra Hospital lawn, and that starts at 10 a.m. and the food is normally finished quickly, so get your food early. The roti was amazing last year. On Thursday 8th, they have a half-day symposium, and that's internal at the Alexandra Hospital room. On Friday 9th, there's a hike to Mount Traverse, and that's the location is Penny's. The start time is 9:30, and the price is only 40 EC. Get out, get active, support the cause. They have a games night on that same Friday night at the location, the GMC building, and the start time is 7 p.m. Saturday 10th is an all-inclusive boat ride that leaves from Wally Dock. That means food and drinks. 5 p.m. or only 120 EC. On Sunday 11th, we cannot finish a week without praising God, and so they'll be at First Baptist Church in Maddens at 10 a.m. And to round off the activity, we'll be having the T-shirt day. Every year there's a nicely decorated T-shirt on Monday 12th. Please contact any of the nurses if you want to purchase a T-shirt. You can contact the hospital or the ministry who can put you in touch, and you'll be able to support that cause. And I'll round off with community development and their month of activity as well. So they have their community care food drive that's ongoing. So stop by the department, donate your non-perishables like pastas, cereals, any item. Make sure that the items are, of course, in good condition and not expired. These will be donated later on to those in need. On May 3rd, there's a church service at the Seventh-day Adventist Beulah Seventh-day Adventist Church. On May 5th, the highly anticipated Jessup Seafood Fiesta, 11 a.m. until. On May 8th, there's a podcast, Caribbean Migrant Masculinities. And May 17th and 18th, there will be the Beginners Auto Body Repair Workshop. Please try and sign up if you haven't. I'm sure they might be full already even, but check and see. 10 a.m. to 3 p.m. at the Pond Hill Community Center. And the jumbo sale is May 22nd and May 23rd, always anticipated and well attended. 8:30 a.m. to 3:30 p.m. right at the Department of Community Development. On May 27th, the community care food packages will be distributed. And we also have the floral arrangement workshop running currently from April 22nd to May 29. And that's at the Jessup's Community Center on Tuesdays and Thursdays from 5 to 7 p.m. And to round out the month, 31st of May is the Nevis Multicultural Heritage Festival at the Malcolm Gishard Recreational Park from 12 p.m. to 7 p.m. Food, drink, music, family, games, culture galore from across the globe, not just across the region. We had so much variety in representation last year. We look forward to having that again. Also, if you want to have a booth, you can feel free to contact the Department of Community Development. That is only $50 to have a booth there.
I was just going to ask if there's any cost involved in that particular night.
The Nevis Multicultural Festival, well, there is the cost for the booth rental. I haven't heard of a cost to enter the gate yet.
Okay. Now, Honorable, I don't think I'll have you back here before Culturama is finished. You know, I mean, you don't come often enough or so.
I mean, you don't like me, don't invite me.
I invite you all the time. So I want to ask you, Culturama is coming up. What would the minister be doing for Culturama 51? I know you normally play on
my stilts.
On your stilts, Makajambi stilts.
I will be continuing on my stilts for Makajambi. I've restarted my participation in the Pandora's group. It's a women's group in steel band, so I'm hoping we'll participate in Culturama as well. We have not decided yet, but you know, there was a showcase last year as well with them. So hopefully I'll be on the pan, but I'll definitely be on some stilts once I am healthy and able, and I pray to God that I will be.
You will be. Trust me, you will be. Well, Honorable, I want to thank you very much for taking time out of your busy schedule to be with us this evening. It's always a pleasure having you here with us. You don't come often enough, that's true, but you know, it's always a pleasure having you. Your final words for our listening and viewing audience.
Okay, my final words to our audience is always to just remember that in order to grow Nevis together, we have to make it a community effort. It has to be all hands on deck. Each individual has to play their little part, and if you're able to split costs both literally and metaphorically, across a wide number of people, then you're better able to manage sustainability in terms of for the future. So I want to encourage all of us to be able to protect our health, protect our friends, our family, just keep that community spirit, rebuild that community spirit that is declining as well. I think that's generally what my ministry strives to do, to be able to help empower individuals and thus being able to empower the island of Nevis on a whole.
Your face. You caught me off guard. Well, like I said, I want to thank you. I think this evening's discussion was very informative. I learned quite a bit, from the discussion this evening, and I'm sure we're listening and viewing audience will learn a bit. I mean, would have gotten a lot of information from the discussion this evening. So I want to thank you very much. Folks, we have come to the end of another edition of our Government at Work program. Join us again next week when we shall do it all over again. Do enjoy the rest of the evening's programming and have a pleasant night's rest. Good night.